Welcome back to the second part of infectious diseases. In the second part, we're going to discuss some examples of infectious diseases. The malaria. Malaria is a disease of the subtropics by Anopheles mosquito. The symptoms, in summary, we have fever, rigors, usually within 4 weeks of returning from a malaria zone. Diagnosis is by history and seeing the parasite in a blood film. Typhoid. It's caused by Salmonella typhi bacteria, transmission through contaminated food or water. The clinical picture, the symptoms begin with malaise, headache, dry cough, and vague abdominal pain up to 21 days after returning from a typhoid infected area. First week there's marked fever with dry cough and constipation, and in the second week the fever persists. The abdomen distends, and there may be diarrhea and raw spots on the sides of the abdomen. There is delirium and death that may occur in untreated cases. Investigation: leukopenia and neutropenia is seen in the blood picture, and blood culture and culture of urine and stools to demonstrate the Salmonella typhi organism. Dysentery. Dysentery is inflammation of the intestine causing diarrhea with blood and mucus in stools. And we have two types: the bacillary dysentery or shigellosis and the amoebic dysentery. The bacillary dysentery is caused by Shigella sonnei. It's a serious disease including septicemia. It can lead to septicemia, which is multiplication of the organism in the blood. It is transmitted by fecal contamination of food and water, and the symptoms: 2 to 4 days after ingestion, there is acute diarrhea accompanied by abdominal colic, vomiting, and tenesmus, and if severe, rectal blood, mucus, and pus. Asymptomatic carrier can occur. In amoebic dysentery, it is caused by the protozoan Entamoeba histolytica. There is an acute form and a chronic form. The complications can lead to hepatic abscesses and pericolic amoebomas, which can be confused with cancer colon. Diagnosis by demonstrating the trophozoites or the cysts in the stools and supported by a positive complement fixation test. Pyrexia of unknown origin. It is defined as fever of 38.3 degrees centigrade or more for at least 3 weeks with no identified cause. This table shows the main causes of pyrexia of unknown origin, or PUO. Number 1, infections. Number 2, malignancy. Number 3, autoimmune diseases. Number 4, granulomas. And finally, iatrogenic in origin. Infections can be bacterial, viral, protozoal, or specific, and we have examples. Malignancy can be kidney or liver, whether primary or secondary tumor, pancreatic, micrometastasis, lymphoma, Hodgkin's, non-Hodgkin's lymphomas, and leukemia. Autoimmune diseases, we have the systemic lupus erythematosus, polyarthritis nodosa, and others. Granulomas like sarcoidosis and Crohn's disease, and the iatrogenic, which is an infection caused by the medical field personnel like nurses, doctors, and paramedicals. Septicemia. Septicemia is a serious, life-threatening infection that gets worse very quickly due to invasion of the bloodstream by virulent bacteria coming from a local site of infection. The common organisms are Staph aureus, E. coli, Klebsiella pneumoniae, and Enterococci. Common sources include IV catheters, genitourinary and respiratory tract, and intra-abdominal septic foci. Management: generally, good nursing care is needed. Fluid and electrolyte balance should be provided. Vigorous antimicrobials, and in severe cases where there is shock, which is called septic shock, we need intensive therapy in the ICU, including treatment of shock and treatment of renal failure. HIV infection, human immunodeficiency virus. HIV infects primarily the CD4 helper T lymphocytes, leading to decreased CD4 cell counts with impaired cell-mediated immunity. Eventually, the immune system becomes deficient and the patient develops infectious, neurological, and neoplastic complications characteristic of AIDS. Viral transmission and infection is through sexual contact or blood-borne, IV drug abuse or blood transfusion, or it can be congenital. About 20% of children born to HIV-positive mothers are infected. Some also are reported to get infected through breastfeeding. Natural history of HIV infection. 2 to 6 weeks following the exposure, we get a flu-like symptoms like fever, sore throat, fatigue, muscle and joint pains, rash, and lymphadenopathy. 2 to 6 weeks later, the antibody test for HIV becomes positive. Then, after many years, we get many years of asymptomatic period with gradual decrease of the CD4 lymphocytes. The normal CD4 count is between 1,200 to 1,400. When the CD4 lymphocytes become between 200 and 500, we get symptoms of malaise, fever, weight loss, and mild symptoms of opportunistic infections like moniliasis, histoplasmosis, herpes simplex, and neoplasm like Kaposi sarcoma, non-Hodgkin lymphoma, and others. But when the CD4 count falls below 200, we get the severe, life-threatening, opportunistic infections with serious effects on the GI tract, CNS, lymphatic system, kidney, and lung. The opportunistic infections in HIV, the most frequently are candidiasis or moniliasis, pneumocystis jirovecii pneumonia, mycobacterial infections, cytomegalovirus infection, cryptococcal infection, diarrhea, herpes simplex, herpes zoster, and progressive multifocal leukoencephalopathy. The WHO immunological classification for established HIV infection shows that the percentage of the CD4 count represents the percentage of the total lymphocytes that are CD4 cells. It classifies the HIV patients into none or not significant if the CD4 count is more than 500. It is mild when it is between 350 to 499, and advanced when it's between 200 and 349, and it is severe when the CD4 count is less than 200. Primary treatment of HIV. Patients should start the antiretroviral treatment before they become unwell or develop opportunistic infections. The dental consideration in AIDS, any needle stick injury involving the blood or saliva of a patient should be reported immediately so that an appropriate needle stick protocol can be initiated and follow up of this patient. Herpes simplex. Herpes simplex are a group of viruses including herpes simplex type 1, herpes simplex type 2, herpes zoster, Epstein-Barr, cytomegalovirus, and others. Herpes simplex virus type 1 can be transmitted to dentists. The transmission is through personal contact when there are vesicles present at the mucocutaneous junctions of the oral cavity. The virus particles are present in the vesicles, and the greatest risk is during the first 24 hours of vesical eruption. Pain precedes the vesicles and the resolution takes between 10 to 20 days. Herpetic whitlow is infection in fingers and fingernails. It's called herpetic whitlow. If we get a patient having herpes simplex in the lips, we have to postpone dental treatment until the herpes lesions resolve, except for emergency cases. Infectious mononucleosis or glandular fever is a common disease of the young with excellent prognosis. It's very common with a seroprevalence of more than 90% of adults. It's transmitted via the saliva. It's caused by Epstein virus, which is a herpes virus. Clinical presentation, there's a fever, malaise, sore throat, muscle and joint aches, and lymphadenopathy. Examination shows tonsillar inflammation, exudate with palatal petechiae, generalized lymphadenopathy, and splenomegaly. A skin rash is common, especially if ampicillin is given. Mesenteric adenitis with appendicitis also may occur. The differential diagnosis of infectious mononucleosis includes acute tonsillitis, infections with similar rash as measles, rubella, infections with malaise, lymphadenopathy like toxoplasmosis, brucellosis, tuberculosis, lymphomas and leukemias, AIDS, drug hypersensitivity, acute appendicitis, and diphtheria. Treatment includes rest, aspirin, and anesthetic lozenges for sore throat, steroids if tonsillar enlargement is great and swallowing is difficult or the airway is obstructed or threatened. Tuberculosis is caused by the acid-fast bacillus, Mycobacterium tuberculosis. It affects predominantly the lungs, lymph nodes, and gut. It's transmitted by airborne infection when the tubercle bacilli travel to the lungs where they remain alive but inactive. Primary tuberculosis in non-sensitive patients not previously infected or who have not taken the TB vaccine, which is called the BCG vaccine. There is a mild inflammation in the lungs or the pharynx or ileum, followed by spread to the regional lymph nodes, whether hilar, cervical, and mesenteric lymph nodes respectively, forming the primary complex. Tuberculin sensitivity becomes positive 1 to 2 weeks following the infection. It is symptomless. It is subclinical with rare blood dissemination. However, once infected, a person is at risk for developing active disease in the future when his immunity declines. The post-primary tuberculosis or the active tuberculosis, where there is reactivation or reinfection in the previously infected, that's to say the tuberculin sensitive patient when the immune system is down. Predisposing factors include immunosuppression by chemotherapy or malnutrition or substance abuse and HIV. Pulmonary TB is the most common, but we get also extrapulmonary tuberculosis affecting the bones in the spine, kidneys, brain, lymph nodes. Oral lesions commonly affects the tongue, the lips, buccal mucosa, and palate. The fate of tuberculous lesions. They may heal with fibrosis and calcification. They may rupture into bronchus, giving tuberculous bronchopneumonia. They may spread via the blood to produce biliary TB of the liver, spleen, lungs, choroid, bone, and meninges. Treatment is by using multiple antibiotics for long periods of time, at least 9 months. Active pulmonary TB and dental practice. Defer dental treatment for patients with active disease until they have received the full course of anti-tuberculous treatment. Patients with risk factors for TB are considered potentially infectious, and these include recent contact with patient having active disease, recent immigrants from areas with a high prevalence of TB, IV drug abusers, immunocompromised, especially HIV. In emergency treatment, in case of emergency, we have to reduce the aerosols, use a rubber dam, wear masks and spectacles, and ensure that there is adequate ventilation in the area. Thank you very much.